All right, we're streaming live. I'm going to get us going. So thanks for joining us again today, everyone. It's Tuesday, June 23rd, and you're at another media briefing. I think we're at about 40 or 41, so we're all pretty used to this by now. Today we will have statements from two of our three panel members. So first up, we'll have Acting Medical Officer of Health, Dr. Hsiu-Li Wang, followed by Regional Chair Karen Redman. We also have Mike Murray, our CAO, waiting in the wings to answer any questions. So with that, I will pass it over to Dr. Wang. Go ahead, Hsiu-Li.
Thank you, Bethany. Good morning, all. So in terms of overall trends, we continue to see cases reported, but overall the status of COVID-19 in our community is stable. Testing volumes have continued to increase. And so it is expected that we could see increasing numbers of people test positive. The percentage of those who test positive among those who are tested, however, has continued to decrease. As of 10:30 a.m. this morning, we have 87 active cases in Waterloo Region. A total of 30,516 tests have been performed, with positive results for approximately 4.1% of all tests. A total of 1,055 cases, or 84% of positive cases in Waterloo Region, are now resolved. There are currently 13 people in hospital. Outbreaks in long-term care and retirement homes are also stable. There are currently 3 outbreaks in these settings. With the enhanced monitoring and testing in long-term care and retirement homes, it is expected that these facilities may continue to experience outbreaks. We do not currently have any active outbreaks in other congregate settings or workplace settings. The first wave is not over. The virus is still active in our community. The virus is spread by people, and we have a collective responsibility to protect each other. In everything that we do, whether it's going to the store, picking up library books, or checking in on loved ones, we need to protect each other. We help protect our families, our friends, and our community when we practice physical distancing, wear a mask when physical distancing cannot be guaranteed, wash our hands often, cover our coughs, avoid touching our faces or fiddling with our masks. We protect our community when we stay home and isolate from others, including family members, if we start to develop symptoms. We protect our community when we get tested if we start to develop symptoms. Together, these measures are part of a comprehensive approach to help reduce the spread of COVID-19 in our region. This is our new normal, and it will continue to be for a long time to come. Our continued progress is in our hands, and we all have a role to play. Thank you.
Thanks, Hsiu-Li. I'll pass it over to Chair Redman. Go ahead, Karen.
Thanks, Bethany. At the beginning of the pandemic, the abrupt closure of regional facilities changed the way some of our services were being offered. We've made many technological strides since then to include new online services. We now are streaming council meetings online, accepting more online payments, offering virtual seminars and support, and conducting regular online media conferences. This Thursday, we will host our first interactive online public consultation meeting. Holding public meetings to get feedback on plans and projects is a long-standing tradition for the region. Now, instead of hosting feedback sessions in person, you can join in an interactive virtual meeting. For example, community planners will be available June 25th from 6 to 8 p.m. to gather input and answer questions on how the region will grow to the year 2041. With social gathering limitations still in place, moving our public engagement meetings to a virtual forum makes sense, and we're hoping it will allow more members of the public to join us and share their feedback. Stay tuned for more projected public consultation meetings coming online. Thank you.
Thanks, Karen. All right, I'll turn it over to the media for questions, and let's start with Kate.
Good morning, everyone. To start out, we saw that a new restaurant in the region has a staff member who has tested positive. So Dr. Wang, can you just kind of go through the steps again of what a restaurant needs to do when a staff member tests positive, and how they get that information out to the public and public health?
Sure. So, as we are broadly testing in the community, it's expected that we're going to have people who test positive, and it will depend on the assessment of the risk. So we assess the cases and their contacts, and if we determine that there is an increased risk for the broader public, then there would be a public notification on the part of public health. That said, businesses may choose to disclose themselves for reasons that are, different from public health. But from a public health perspective, if we felt there was an increased risk to the public, then we would provide that information to the public. But if there isn't, then if there's a situation of an outbreak that again doesn't put the public at increased risk, then we would post that on our website as part of our aggregate count of workplace outbreaks.
So then in terms of like contact tracing, say it's a server who may have had contact with multiple people throughout a shift, is contact tracing possible, or is that a situation where you would put it on the website?
Yeah, contact tracing may or may not be possible depending on the types of contacts this person had and the types of measures that were put in place to prevent the spread of infection. So contact tracing looks at potential contacts that may have been at increased risk, not only, the number of persons as a particular person may have had contact with, but it assesses the risk of those types of contacts.
And I know that the province has put out guidelines for how restaurants are to maneuver through all of this, but is there any difference between, are there recommendations that aren't mandatory that restaurants have to follow? And are there some that are mandatory? Like as soon as they have a server, do they have to contact public health?
Oh, the restaurant wouldn't need to contact public health because public health would get all the results from the laboratories directly for any positive cases. So we would directly follow up with positive cases and then evaluate based on the individual circumstances of the case, the potential risk to others. And if it was a business setting, yes, we would be in contact with the business setting.
Okay, and just to switch gears a little bit, some companies, given that we're a tech hub in Waterloo region, may have employees or senior management coming from the US for essential work business. When they come here, is public health told either by border officials that they're coming to the area so that somebody's monitoring to make sure that they maintain that 14-day quarantine when they come into town for work?
The quarantine order is issued by the federal government, and they are the ones that also monitor for adherence to the order. So local public health officials are not provided that information. It's directly issued and enforced by the Canadian Border Services Agency. And anyone coming in would be under a mandatory 14-day quarantine.
And if someone came in and decided that they didn't want to follow that quarantine order, it would be up to the border officials, not public health, to handle that.
Mhm. That's correct.
Okay. I'll leave it there for now. I have more questions, but I'll wait.
Okay.
All right, thanks, Kate. We'll move it along to Damon from the Woolwich Observer.
Hi, so my question's for Dr. Wang. Woolwich Township is above the average for Waterloo Region, so what message should you be sending to residents here?
I think, as I had mentioned previously, because of the fact that testing was quite limited, in the past, although now it's much more broadly available, I think what we can take away from rates in different municipalities is that all the area municipalities have cases of COVID-19, and that you could get COVID-19 anywhere in the region. So I don't believe that there are specific townships that are at greater or lower risk. I think that this is a virus that is spread broadly, and the risk is broadly present across the region. So my advice for the residents of the Woolwich Township would be the same as for all the residents in the region, and it'd be those public health practices that I've been mentioning.
Okay, that's all my questions for now. Thank you.
Great, thanks, Damon. We will pass it over to Tim from 570. Go ahead, Tim.
Hi, Jen.
Hi, good morning. My question's for Dr. Wang. I just, there's apps right now with contact tracing, and when it regards someone being close proximity with someone who may have the virus. Is this something that public health is discussing with either universities that are developing this or governments?
Thanks for the question, Tim. So actually the province is going to roll out a provincial app. So they are going to roll that out soon. I don't know the exact timelines. And when we get more information about it and our residents are going to be able to sign up, that's definitely something that Region of Waterloo Public Health will be promoting. We understand that the province has put a high priority on privacy. So it's something that this app meets the requirements of. And so we're going to be, supporting the adoption of this app amongst our residents.
So when it does get adopted, it requires testing information, so it's completely voluntary?
Yes, it is voluntary. It would require, people to sign up, and if they get a positive test, for them to give permission to notify others who may have been in close contact with them anonymously.
Right. Okay. So we talk about the new normal, and we like this for a long period of time for the near future. With this contact tracing app, would that help lower, or would it lower that our new normal, or will it just stay the same?
No, it would be the same, but it would be another tool that we could use in order to inform people that they need to self-monitor, or in specific situations they may need to self-isolate, and recommend that they get tested. So it would just be another tool as an additional tool that the public health units could use in order to help us contact people that may have been contacts of a particular case. It can be hard for someone to remember in the 14 days before their diagnosis, all the people that they were potentially in contact with. And so this app is another means for which to get that type of information more automatically logged in. So it depends on people's willingness to adopt it, but it's something that we'll be promoting.
Those are all my questions for now. Thank you.
Thanks.
Thanks, Tim. I will pass it over to Joanna from the Record. Go ahead, Joanna.
Thank you. A couple questions for Dr. Wang. You talked about the rate of positive tests going down. And sorry, I don't recall exactly where it was sort of near the beginning of all this. Do you have that?
I don't have that specifically with me because there were some limitations to the laboratory data systems in the early phases of the pandemic, such that a significant portion of the tests done in our region were missing from that database. So it's hard to know at this point in time. We understand they're looking into that to see if they can correct things in the past, but for now, it's hard to know exactly what our percentage was, but for sure it was higher. I don't have that, but what we have been seeing in the last few weeks even, we saw the percentage go from 6% down to 5%, and now we are at, I think I said 4.1%. So you can see that decreasing over time. So that's a good sign. It's a sign that we're, being able to test more people. And as we are able to test more people, then we're able to get a more precise assessment of, the number of positive cases that are really out there.
Do you have some concern though that as people see that number goes down and more people are testing negative, that they might feel reassured, like think that, the risk is less now?
Well, no, that's a good question. I think that, the fact that we still have cases that are picked up through testing shows that we still have community circulation of this virus. And as long as we have community circulation of this virus, and as long as we see, like we've seen in other areas in the world, that the number of new infections can rapidly increase if people are not careful, I think it's a message that I'll continue to try to remind people of, which is that the risk continues to be present, and until we have an effective vaccine and the pandemic is over, we're going to need to continue to follow public health measures that reduce the risk of spread, such as measures related to physical distancing. And so that's going to be part of our new normal going forward. But you're right. I mean, it's a message that probably I'll have to continue to remind people of, because as our overall situation in the community has significantly improved, and we are in a much better state now than we were 2 months ago. And so people can sort of feel maybe they don't need to follow the public health measures as much, but they need to continue to follow it, especially as we open up the economy and lift restrictions, and there are more people that are interacting with each other.
Okay. And just another question related to testing. Now that people can visit long-term care homes, but they need to be tested every 2 weeks and have a negative result. I know you don't look at, public health doesn't look after the testing centers, but do you have some concern that that's putting like a lot of pressure on the capacity locally, and it's contributing to long lines at the drive-through testing or long waits for people who are booking appointments?
Yeah, so that's a government directive, a provincial directive. So obviously, yes, that has increased the number of people that need to get tested. I really appreciate, for example, all the testing partners, all their efforts in testing people, including, Grand River Hospital, and all the staff that are working on that drive-through testing site, and that's really increasing our capacity for testing. And I understand, they've had a lot of demand lately, and that people have had to wait to get tested longer than Grand River Hospital would like. So they're looking at ways that they can try to reduce that wait time going forward. So I think, I think overall it's good that we have a lot of testing capacity. It's good that people want to take up testing. And I think, as new options opened, there might be some volume that wasn't initially expected, and so the testing partners are going to look to make some adjustments to try to alleviate that. And I think overall, it's a good thing.
Okay, thank you.
Thanks, Joanna. Over to Nicole from CCB.
Hi, good morning. This message is for Dr. Wang. Friday afternoon, the province announced that it will be up to individual school boards to decide their plan in regards to how they should open up based on their, what's going on in their region. What discussions are you having with the local boards in terms of this fall school year?
Yeah, no, it's a great question. I mean, we have partnered with the school boards for a long time, and often after these government announcements, there's documentation that comes out that provides specific information on the government's expectations. And so we're waiting for that information to provide a bit more clarity. But I'm sure that the school boards are preparing along the lines of what the government announced. And, we'll be engaging them in conversations when we receive more specifics.
Would you say that Waterloo Region, because you said at the top of this call that we're stabilized, would you recommend, I guess, a more full return to classes, like 75% in class, 25% online learning?
It would really need to be the school boards that look at, what they need to look at all the options, and they would need to see what's possible for them as well. I think the minister did say on Friday that his expectation is that likely what would be used most often is a hybrid model. And so, we're sort of awaiting more specifics around his expectations. But I think that, as part of the new normal, there's going to be requirements related to things such as enabling physical distancing, screening, hand washing, things like that. And so, it will, I can't say right now exactly what would be recommended in specific settings, because that would need to be looked at by the board. But public health is available for consultation as always.
Getting back to the mask debate, we've seen Windsor Public Health issue an order, and in California, they issued an order. I'm just wondering where you guys are at in terms of having that discussion and making it a potential order, because, frankly, out on the weekend, I didn't see very many people wearing masks when I was out grocery shopping myself. So where does public health currently stand with that discussion?
Yeah, so I'm continuing to listen. It's a situation that we're continuing to monitor. And I don't have any new announcements to make or anything at this time. And maybe Mike wants to say something. I think he's on mute.
Yeah, the only other thing I would add, I think we continue to monitor what's going on around us. The one, specific area that we're looking very, very carefully at is transit. And, I think the overall message has been, maintain physical distancing as much as possible. And when it's not possible to maintain physical distancing, strongly recommended to wear a mask. And so one of those areas where, as the number of transit customers increase, it will become increasingly challenging to maintain physical distancing on Grand River Transit vehicles. So that is something that we're looking really seriously at, mandatory masks on transit. So stay tuned on that.
Mhm.
And we're sort of a week and a half into the phase 2. Do you feel we're possibly, or would you give the green light for Waterloo Region to hit phase 3 or enter phase 3? Since they said it would normally take about 2 to 4 weeks, depending on how the numbers were. So since we're a week and a half into week 2, wondering how phase 3 sort of looks like on the horizon for Waterloo Region.
And maybe I'll just repeat what I said before, and that is, we're taking our lead from the province on, phase 1, phase 2, phase 3, and we've said that before, right? Our trigger for moving to phase 2 was when the province opened the door to that, and when they amended emergency orders to allow certain things to happen in Waterloo Region in terms of phase 2. And so I think it will be the same moving from phase 2 to phase 3. The province is monitoring that carefully. I think they've wisely taken sort of a region by region approach. I think between Region of Waterloo Public Health and the province, we'll take our guidance from them on when it's safe to move to phase 3.
Okay, and getting back to the GRT, you mentioned, look out for messaging in regards to that. What have the volumes been like since we've entered phase 2? Have volumes gone up to really make you reconsider the mask wearing policy?
Yeah, so what we are seeing is ridership on transit gradually, slowly increasing. As more people are going back to work, some of those people need to get around using transit. So we're seeing transit ridership slowly coming back. I don't have like today's data, but as of last week, we were seeing gradual increases. So that's something that we're monitoring really, really carefully, because we want to make sure we can continue to provide a safe environment for transit customers and for our operators. And if that requires going to the next step and making masks mandatory, then that may be something that that we need to do.
That's it for me. Thank you.
Great, thanks, Nicole. I'm just going to take a look at the grid and see if anyone waves their hand for another question. I'm guessing Kate is going to. Go ahead, Kate.
You know me so well. Just another question for Dr. Wang, because last week we did learn about that you want to talk to businesses about the masks.
Mhm.
Is there a timeline for that? Like when you hope to have that report back to council or wherever it goes?
Well, it's a consultation with businesses. It's an initial one, and that's going to take place later this week.
So then you would know, maybe you'd have more of a sense next week as to how businesses are feeling?
Yes, I would.
All right, so next Tuesday we can ask about that. Chair Redman, I want to switch gears just briefly and ask you about Les Armstrong posting a White Lives Matter video. What are your thoughts on that, and what happens now? He's a regional councillor along with a mayor, so is there any repercussions for that sort of thing?
So Kate, happy to answer the question. This is a meeting briefing about COVID, so happy to talk to any of you or all of you offline, but I would rather do that at a different time than right now.
Is there a reason for that? I mean, we're all here right now rather than doing multiple interviews.
It's always been the premise that we've all respected the fact this has been a partnership, and we certainly couldn't have done it without our trusted media sources, but this is about COVID. The whole anti-discrimination and systemic discrimination issue is huge. It's in the community. I am actually on the public record with my first response to that. And again, we'd be really happy to talk to any and all of you separately, but not right now.
All right, so Kate, we can follow up with that if you want to reach out to me or Brian. Any other questions from media? Okay, Nicole, go ahead.
The dashboard, when can we expect the neighborhood data of cases? You said it was coming soon. I'm just wondering if that could be this week.
No, it's being worked on actively. So I don't have a precise date at this time, but soon.
Anything further, Nicole?
I think I said about last week, within a couple of weeks. So in that time frame.
Okay, last call for any final questions. Seeing none. Meeting dismissed. Thanks, guys. We'll have another media briefing on Friday, and we appreciate you joining and sharing these important messages as always. Thanks a lot.
Thank you.